I've known anecdotally the influence the storylines can have on the populace going back 30 years to when we did ER storylines, the power of television and the power of storytelling. So in this venture, it was really that much more significant to us to meet with experts, get our facts and figures correct.
We try to be accurate and current in any medical topic that we cover. Our primary job is to tell great, compelling, complex, emotional stories, but our commitment to accuracy has this wonderful side effect to educate not only the public, but professional audiences as well. We've had doctors write to us and say they've recognized a case of measles or a case of methemoglobinemia because of something that they saw. And more importantly, emergency personnel have talked about recognizing their own post-traumatic stress from COVID and from overcrowding and the stresses of emergency medicine in 2025, and have in fact sought help based on stories that they've seen.
It's really meaningful, and I also love being on something that makes the whole medical community really feel seen and appreciated, and they're just pushed to their limits right now. So I'm just grateful that I can bring that.
When I'm asked what the idea of the Norman Lear Center is, I have a two-word answer. Stories matter.
For 25 years, Hollywood Health and Society has been a go-to resource for TV writers to get factual information and connect with experts on the front lines of health, medicine, and science.
This organization has been instrumental in getting us, a lot of the kudos that we're enjoying.
The work of the Norman Lear Center's research arm, the Media Impact Project, that collects quantitative and qualitative actual data on the impact that your shows have.
We found that these authentic storylines really resonated with medical professionals. They made them feel validated, feel seen, particularly in the depiction of the hidden factors that we don't often see in medicine and the attention to these systemic challenges. We found that 1 in 4 viewers who saw the organ donation storyline said that they actually sought more information about organ donation. And over 1/3 of viewers of the end-of-life storyline sought more information about end-of-life planning. And that's 2 to 3 times as often as those who did not see those storylines.
It's wonderful to hear about research that shows objectively that our audiences have really made a difference in their knowledge, attitudes, and behavior about topics such as organ donation and end of life. We've always known anecdotally through social media postings that people have, in fact, responded in very big, meaningful ways.
It's truly, truly incredible, especially when you put so much of your life and so much hard work into doing the research and really trying to tell accurate and authentic stories. We're creating art, but to have this kind of real life impact is just, it's mind-blowing. And if it has any positive resonance, especially in this time in our society, it's a bonus.
I think it's fantastic that they did the study to get computational data on it.
All of these things that in society have a domino effect and always trickle down into the ER. And that is someplace, because of our show, we're able to highlight all of these issues that seem sometimes non-typical for a medical drama.
When you have a format that allows you to reach millions of people every week, that comes with a certain amount of responsibility. And we take that to heart.
Thanks to Hollywood Health and Society, we got an all-star team of experts, both in season 1 and season 2, to draw our storylines from.
Change the narrative, change the world.